Welcome to the Maximize Your Medicare Weekly on the eve of Super Bowl 55. As you can see, I've got the jacket of my alma mater on, which means tomorrow, for better or worse, maybe against my better judgment, I'm going to be riding with this. We'll see. Welcome everybody, my name is J.O. I'm the author of Maximize Your Medicare. Complete information about the book, MaximizeYourMedicare.com. Lots of other resources, links to podcasts, videos, free newsletter. You can sign up there on the website, www.MaximizeYourMedicare.com. So the first segment today is about the days that are about to follow in the next week, starting on February 15th. The Affordable Care Act, ACA, healthcare.gov, the state websites to sign up for individual health insurance pre-65, that is going to reopen on a federal level. It runs from February 15th through May 15th. You have to use your state portal or healthcare.gov, whichever one applies to you. Now, in addition to that, we see other small incremental changes, but some of them can be valuable depending on what happens in Washington, D.C. As we know, we have a new president. President Biden is the one who opened up the ACA portal, in other words, for this special enrollment period. That part is already in the can. Okay? There's no way to get away from that. That is a go. What isn't yet resolved has to do with the COVID relief bill. Tucked inside is a provision to limit the health insurance premiums that you pay to 8.5% of your income. And if it exceeds that, then you'll be capped, meaning that it could lower your health insurance premium notably. Now, this is different assistance than the Medicaid expansion, right? Because in other words, this 8.5% limit, it doesn't seem to be talking about the out-of-pocket maximum deductible copay schedule. Okay? So there are these two pockets of financial assistance. There's the APTC, Advanced Premium Tax Credit. That's Medicaid expansion. That's not full Medicaid. Listen to my other broadcast about that. Okay? That can lower your premium. In addition to that, inside there on silver plans is a lowering of your deductible and your out-of-pocket maximum. These are valuable. For example, what used to be a $5,000 deductible may be down to $2,400. And I'm making up examples, but they're notable. Right? So it's not only the premium relief that you can get. It can also be a lower out-of-pocket maximum, a lower deductible. That is part of this. Okay? Over here on the COVID Relief Act, and let's just call it COVID Relief Act. I'm sure it's got some, fancy name that I don't know. That relief is the 8.5% cap. Now, could it have been done differently? Yes, it could have. Right? It could have just been this, except for to a wider number of people. I'm not here to settle that with you. I'm not a legislator. I don't want to be in the middle of the legislative debate. Okay? I'm here to explain the world as it is, not a utopia that, we cannot agree upon, on a nationwide basis. That's just not what I'm here for. I'm here, okay, here are the rules, here's the way that work. How can everyday people from every different walk of life get the most they can for their dollar? That's the point here. So that period's coming up February 15th through May 15th. Remember one last point. is that if you have lost health insurance for some other reason, it could be you became unmarried and lost your health insurance as a result. You lost employment. Your employer canceled health insurance benefits. In other words, if there's some other cause that you've lost your health insurance benefits, then you have a different type of special enrollment period, which is basically a side door to allow you to enroll in individual health insurance. Note that those special enrollment periods can be actually better than the COVID-related February 15th special enrollment period. It's super subtle, right? The selection of plans is different. The selection of plans is different. For example, between February 15th and May 15th, you must use the portal. However, if you have a different special enrollment period, let's say you were unemployed and then lost your health insurance as a result, then you have a wider selection. That's the reality. If this sounds super complicated for an everyday person to actually execute, there's a reason. It's actually more complicated than all of that. You don't want to have a 90-minute video just on all the ins and outs of enrolling for individual health insurance. If you go to the website, healthcare.gov, you can see there find local help. I can't tell you who signed up for that. Okay, I know that I am because I had to get permission to do so. And then I signed up also to say if somebody wants to call, I'll call them back within, 15 minutes. So that you can have if you got to me through the portal. Or you can just send me an email at the address in this post and go from there. Before we get going to the news segment, don't forget GH2 Unfiltered. That's www.gh2unfiltered.com, where you can find my opinions and other things that I can't really share in public. There are reasons for doing so. I'm highly regulated. In addition to that, I don't want my more subtle messages to be mishandled just by the passers-by who are clicking for 5 seconds and then going on to the next topic. For less than $2 a month, you can get my thoughts, my inside thoughts about specific situations, whether that be on advertisements or the way that insurance or other very important aspects of life and financial planning actually work. For first-time subscribers, a special offer. I'll send you a copy of Maximize Your Medicare, and I'll pay for postage in the lower 48. So once again, gh2unfiltered.com. And oh yeah, by the way, even if you're not going to subscribe to GH2 Unfiltered, be sure to like and subscribe to the channel. Thanks. It's that time again. It's time for another segment of See Me After Class. Now, I want to clear up something, which is that you may think that I created See Me After Class just to dunk on someone, right? Just to make fun of somebody, just to prove that I'm smarter than them or something like that. But the reality is that's not the reason. The real reason for See Me After Class is because of the way that we are fed information, the way that you read information, and the fact that important, vital facts can be left unsaid, unexplained. Why? There are limits. For example, and today we're going to be taking a look at a Twitter entry from a U.S. congresswoman in this instance. Okay, and the fact of the matter is that you can easily gloss over and the message may optically look very attractive. However, but like I said, I've speculated, I've suggested kind of tongue-in-cheek that maybe I should call this the Yabbit channel. Right? In other words, there's other rationales involved, and those are not trivial. Right? In fact, they can be super important and not revealed in the little tweet or soundbite or Facebook entry or, war story at the bar or under, while you're hanging out with your friends or family. And the fact of the matter is that if you don't look at the other side of the coin, which includes the edge of the coin, as low probability as it may be, then you're not seeing other perspectives. And when you don't see the other perspective, it creates a blind spot, and now all of a sudden you're down a path, and then 2 to 3 other exercises later, we've got the entirely wrong conclusion, and then people make financial mistakes. And now you can understand why I created See Me After Class. So with that introduction out of the way, kind of a long-winded one, we see this tweet here by Representative Katie Porter. Now, Katie Porter is from the state of California. And as normal for viewers of the channel and to newcomers, welcome. Be sure to like and subscribe. The fact of the matter is that, Representative Porter is not your average person. I wouldn't ever dream of calling her the average person. She's an attorney. She's not only an attorney, she's a law professor. In other words, academic topics, right? Academic topics are not going to be too difficult for her to grasp. In other words, we need to understand, as I do, which is that the other person in the room is not dumb. Not. However, you can see this. Let's just talk about this tweet. And oh yeah, by the way, this is from the Facebook closed Maximize Your Medicare community. So you go to Facebook to Maximize Your Medicare. There's a closed community. You have to ask permission. I'm going to grant it. But in there, I see lots of little news bites and share other information on the fly. Anyway, back to Katie Porter. Under current law, seniors are subject to a 10% penalty for each year they delay enrolling in Medicare Part B. True. This fee can quickly skyrocket, handcuffing older Americans to higher bills for life. True. Today I'm introducing a bipartisan bill to protect seniors from this unfair charge. See me after class. Why? So now you can understand that this looks optically attractive, right? It is true. If you don't enroll in Part B when you should have, and you have a break in health insurance coverage, and after 8 months, then yes, you are subject to a 10% per 12-month period that you did not enroll in Part B when you should have. And this penalty lasts forever. So if it's for 5 years, then you have 50% on top of the Part B premium. I had to return because I'm back because I had to have a gargantuan sneeze in between there. Okay, so now we've got this 10% charge and it lasts for life. So again, if you're 5 years delayed and you use 5 times 10%, 50% higher than the Part B premium, and this charge doesn't ever expire throughout your lifetime. All of that is true. All of that is true. Now, today I'm introducing a bipartisan bill to protect seniors from this unfair charge. And without getting too far into the weeds, here's a screenshot here. Now, a couple of things. Number one, this entry doesn't exactly specify what it means by protect seniors from this unfair charge. The fact of the matter is, Representative Porter is not proposing a complete elimination of the 10% penalty. She's not. Okay? In other words, there are very specific details where you get charged the 10% penalty, but it's limited to a specific amount of time. And that, you can kind of understand its point, which is that somebody makes a mistake. They didn't understand how Medicare actually worked, etc., etc., in which case, then they enroll late and then they have to incur this penalty. It never expires for this mistake. Crazy people write books in order to help people not make this mistake, for example. But more underneath that is an extra layer, and it's not trivial. So now let's just take yourself as a 67-year-old person. You're already enrolled in Medicare Part A and Part B. You've been enrolled for 2 years. You've played by the rules. You don't have a penalty. What have you been doing? You've been paying the Part B premium into the federal government to be dispersed amongst the persons who require health insurance coverage because they're incurring health care costs. Fairly clear. That is the basic math of the way the insurance works. So now, in addition to that, that person's younger sister is 64.9 years old. They understand the rules. And let's just say Representative Porter's bill is enacted into law. So what does your 64.9-year-old sibling do? I'll tell you what she does. She reads my new book, which has now been modified, and what will it say? It will say, if you have no pre-existing condition, and if you're 64.9 years old and Miss Perfect, never sick, no medications, guess what? You can just call me any old time later. Guess who else is going to do that? Everyone else who doesn't require health insurance. Now what ends up happening? Now the 67-year-old person, right, ends up footing the bill for only the sick people. Right? Why? Because let's just say the 67-year-old person had twin sisters, both 64.9 years old. One sister is Miss Perfect. She won the DNA coin flip. Never sick. She doesn't enroll in Part B. Why? Because the late enrollment penalty is limited. So if it's a 10% penalty and it only lasts for a year, 10% of, let's just call it $1,800 is $180. Okay. So now the 64.9-year-old is now 70 years old, never sick, and then finds, some kind of medical incident after going to an annual checkup and says, oh, I need Medicare now, picks up the phone, pays the $180 penalty, and on they go, saving themselves 5 years of Part B premium. That would be the entirely rational decision for the 64.9-year-old. Absolutely. For that twin sister. The second twin sister has lost the DNA coin flip. That person, the ill twin, the sick twin, pre-existing condition twin, she wants to put her hand up for Medicare as soon as possible. She enrolls at 65. Very, very clear. Right? She's diabetic, type 1 diabetic. She goes to the doctor, at least 6 times a year, including specialists, hematologists. She needs testing strips. She needs insulin. She's enrolling for Medicare, and her financial cost has plummeted. Why? Because she used to be on an individual health insurance plan. She used to be cover her employer, where the cost sharing, the deductible copays are far weaker under the group plan. She wants Medicare. Absolutely. No question. Now you're the 67-year-old older sibling. What have you done? All of your money is going to pay for the sick twin, and the healthy twin hasn't contributed a penny into help defraying the cost. Guess what's going to happen to the Part B premium? It's going higher. That's the way that math of insurance works. And now you can understand, this phrase, you may have heard it, called the free rider effect. The 64.9-year-old who's Miss Perfect, never sick, perfect DNA, she delays. Why? Because she's going to eat the 10% penalty because she knows that it's likely not to occur until she's 70, 75, 80. Meanwhile, she's kept the Part B premium in her pocket the entire time with no downside. What does that mean? That means all the other 67-year-olds are only going to be hit with the Part B premium increases from all the groups of the sick people who need to have on Medicare right when they turn 65. Has anyone acted irrationally here? No, these two people have acted entirely rationally. The 64.9-year-old Miss Perfect has done what she should. Absolutely. In fact, she'll pick up Maximize Your Medicare, my book, which will be revised with a new strategy inside. Which is to say, hey, they're not my rules, right? As a private person, as a practitioner that guides people on what the most efficient financial solution would be for any topic, I'm just going to say, look, this is the way the rules work. As you're Miss Perfect. How about this? You call me the moment after you talk to the doctor and said you need to have these tests and this is your possible diagnosis. You call me that moment and we'll get going then. Not until then. Why? You get to keep your Part B premium every month. Sick, Miss Pre-Existing Condition Twin, however, she knows, hey, I've got to go to the doctor 6 times a year at the minimum, and I have got insulin and all these testing equipment that I need to pay for. The best way is to get the cheapest insurance possible. What is that? That is Medicare. Absolutely. Also in my book, right? Meaning that now these two people have acted totally rationally. The 67-year-old pool, which happens to be 63 million people, by the way, right, have all paid into the system, and now these giving the option to these people to be free riders. This is a distortion, right? You can see the different, everyone's acting rationally. They're doing everything in their individual best interest. They're getting financial advice from me. I'm telling them, look, here's the rational approach to each twin, right? The two twins call me independently. I'm going to give them 2 different pieces of financial advice. Absolutely. Because I've taken into account their probability of incurring healthcare cost. And now you can understand why see me after class. Because while this looks like a very attractive change, right, that introducing a bipartisan bill to protect seniors from this unfair charge. Unfair to who? To the 64.9-year-old Miss Perfect who makes a mistake, or who is also never going to require healthcare services until 80 years old, yeah, then it's an unfair charge, right? To the 64.9-year-old who's going to need health insurance anyway because they know that they're going to incur healthcare costs, there's nothing unfair about it. And oh yeah, all the 63 million of 67-year-olds that are currently enrolled in Medicare, this is an incredibly unfair charge. It's an incredibly unfair charge. This bill would create an unfair charge. Why? Because you're going to sock them with the bill. Now, before this segment, ask yourself, where's this explanation here? And it's okay, and you can understand that when I create these segments, when I create See Me After Class, I'm not pointing out, Miss Smith in middle America who has never understood or thought through the math of money for themselves, or the way that insurance works, or the way that probability works, etc., or all these other dynamics. Guess what? That person isn't the author of this tweet. This tweet comes from law professor who has studied law and economics. And very early in that first book that she read about something that says free rider effect. I guarantee it. 100%. not 99%, 100%, this person is educated at a very, very high level. Nevertheless, this is what comes out. And now you can understand that this is the kind of reason that Jay gets aggravated, right? Because this is a strictly qualified person. There's no doubt about it. I have zero doubt. This is a smart person, very much so. Has to be. Right? Without knowing her, she's a law professor. So she has command of academic topics. She has full command of this last 10 minutes. Nevertheless, that's the bill that, and this is what ends up happening, is due to populism, etc., and, trying to get votes, trying to get popular, trying to get likes and retweets. People are trying to send you information distorting the way that things work. And to the 67-year-olds who may say, yeah, that sounds unfair, maybe you need to think about the other perspectives. And for that, Representative Porter, smart and highly accomplished as you are, see me after class. All right, time flies when you're having fun. We've run out of time. Don't forget, Q1, through the end of March, if you're a Medicare Advantage policy owner, you can make a one-time change through the end of March. If for whatever reason you found your Medicare Advantage plan insufficient, or if you found a better one, that is possible, with exceptions for persons who get extra help or on Medicaid. If those are not you, then the first quarter you can make a change. And also don't forget, starting on February 15th, you've got your chance to enroll in individual health insurance for those who are not yet 65. Thanks for watching. Be sure, like and subscribe to the channel. It does help the channel a lot. You'll have to put up with my face for radio and my mumbling Midwest timbre. Anyway, I'm Jay. Thanks for watching. See you next time.